Ms. Furumele, are you on?
Yes, Wayne, I'm on, and apologies. I'm now using my cell phone. Can you hear me?
Okay, great. Thank you, Ms. Furumele. Let me just give a quick introduction, and you can add as well. So, colleagues, Ms. Furumele is the Director for Communicable Disease Control at the National Department of Health. She is also the National IHR focal point for South Africa. Okay, Ms. Furumele, over to you. Please add anything else on your background as you please. Thank you.
Thank you. And I don't think I'll add much, but thank you so much and good morning, colleagues. And thank you for having given us the opportunity. And I think I'll start by saying there's a lot of literature on One Health with a lot of information. You know, we have concepts and definitions ranging from simple to complex. But I think this concept is not new and can be traced back to more than a century ago. It may have been called the One Medicine or the One World, but now I think eventually we're calling it One Health. And there may be some questions as to what is it about One Health, and I know there are confusions because I have realized there is a problem in the appreciation of what the One Health concept is. And I think it is described as an integrated, unifying approach which aims to sustain, balance, and optimize the health of humans, animals, plants, and wider environment, which means if one of these components is not doing well, definitely the whole system is going to be affected. I came to appreciate the One Health when we had the outbreak of SARS, which is the one that started. And it led to the realization that, number one, a previously unknown pathogen can emerge from a wildlife source at any time and in any place and without warning, threaten the health and well-being and economies of all the societies. I think we had an experience of several ones. I'm just recalling the pandemic we had, the pandemic influenza we had when we were busy hosting the 2010. But the second characteristic is that there was a clear need for countries to have the capability and capacity to maintain a very effective alert and response system that will be able to detect and quickly react to these outbreaks of international concern, but also share information about such outbreaks rapidly and transparently. And responding to a large multi-country outbreak or pandemics requires global cooperation and global participation that is going to be using basic principles that are enshrined in the One Health. And colleagues, I think after the COVID-19, we can no longer say preparedness is optional. And we are, as the global community, expected to prepare the next pandemic because it is out there in the communications and the knowledge that definitely another pandemic is coming. And as we prepare for the next pandemic, the One Health concept for me is the missing puzzle piece in the preparation and staging an effective response to pandemic as well as epidemics. This has been confirmed by the recommendation from different international committees that the One Health concept be enshrined in our approach to public health emergencies, with the preparedness thereof as well as the response. And may I also indicate that I was also encouraged by the fact that last year the president added the 10th pillar to the presidential compact. In a meeting last year, I think in May 2023, pandemic preparedness was added as an additional pillar. And I believe it's because now we have realized the importance and what the effect of the pandemic can do and the importance of us as a country being prepared. And I've already said that we cannot look at pandemic preparedness without looking at the One Health approach. The department, together with all stakeholders, is tasked to develop a national plan to mitigate the effect of pandemics in South Africa. It is indeed a tall order. However, I'm confused. We do have the resources to deliver as expected. South Africa is signatory to the international health regulations and is expected to develop competencies for preparedness, detection, and response to zoonotic diseases. The South African Health Forum was established in 2014, followed by a steering committee in 2015. And this forum has done a lot for One Health concept. However, there are still gaps in strengthening the national One Health concept in South Africa. I think I can quickly highlight two critical gaps that I think should be addressed, I think, urgently. One is the participation of all the relevant stakeholders. We do have stakeholders that are already participating and committed, but I believe we are not sort of like representative, and we need to get more stakeholders who have mandates and who also have resources for us to carry out the One Health concept is required in South Africa. And the second one, which I think will be dealt with today, is the issue of establishing a governance structure for the One Health. It is currently, I think, 3 departments that are involved, which is us, the Department of Health. Then we have the Department of Forestry, Fisheries, and the Environment. The third one being Agriculture, Land Reform, and Rural Development. And we're trying to work with several partners, and I think UP is already on board and they're busy working with us towards that. And we also have other partners, and let me not forget to mention Africa, Future Africa. So we are already doing that, but I think we need one structure that will come up with the issues of governance when it comes to the issues of One Health. I would like to thank the One Health Forum together with the partners that we collaborate with in organizing this webinar. The presentations today will be able to update us on what we have achieved, our gaps, as well as recommendations to be compliant and ready. And I've looked at the agenda. The presentations will cover issues like, number one, the outcome of the National Bridging Workshop that was held last year, and the National One Health Forum workshop. And maybe let me also, in hindsight, also consider and thank all the efforts that has been done by the One Health Forum. It was a success, and I think most of you have attended. And I think we still have a lot of outcomes that we need to look at when it comes to this One Health framework based on the outcomes and deliberations that were held during the National Bridging Workshop. And the second one, I think there will be proposed alignment with the Global One Health Joint Plan of Action that will be shared. And there will also be guidance on the establishment of the One Health Committee at provincial level. Share there's somebody there who's, but let me just conclude that by looking at the rich presentation scheduled for this webinar, one can only invite you to indulge in the information and identify our contributions and commitment to making One Health a reality in South Africa. Chair, let me thank you so much for this opportunity, and may this be a successful webinar. And may I also indicate that we are currently responding to cholera, and we're also having a meeting now. Minister would like to get a brief. So unfortunately, I won't be continuing with you, but after this meeting with cholera, I may come back and join the meeting.